we host over 140 investment firms that have signed up to the principles of access to medicine and use our research, who engage with the industry, who use voting rights, who use the results of our research in stock valuation models. Is it important to continue this despite the pushback that we're starting to see?
I think it's going to be increasingly important that investors collaborate and ensure that the message that we've been conveying over the past decade, well over a decade, is still there. But the challenge will also be on the company side. So to what extent will companies, especially in some parts of the world, still feel the liberty to push for better access?
Welcome back to the Health Equity Podcast, a series where we bring global leaders who will be talking about the solutions they're working on to address health equity and access gaps globally. In today's episode, we'll be talking about how institutional investors drive change and responsible investments in the pharmaceutical industry and in the pharmaceutical sector to bridge these gaps. Today's guest is Rogier Snijdewind, Senior Director, Active Ownership at the Dutch institutional investment firm PGGM. Welcome, Rogier.
Thanks for having me.
Rogier, you've spent years working and engaging the pharmaceutical industry on responsible business practices, and you've used our research also to help you guide that engagement. Your work intersects healthcare and finance and drives real impact, is what we've seen, in improving access to medicine. How did your journey lead you to do what you do today?
Well, when I started off engaging, so engagement is the active discussions that we have with companies with certain objectives that we have in mind that we want to achieve through that conversation. And our engagement, I think traditionally, so back in the day, talking about that journey, actually was more about so-called environmental, social, and governance factors that would constitute a risk to companies. So certain risk with regard to climate change, certain risk with regard to labor rights, human rights, etc. And I think access to healthcare, access to medicine is actually the first example that came up where we were actually engaging with a positive impact in mind. Mm-hmm. So it steered away from a risk approach and actually looked more at the subject more from a opportunity approach or objective. Mm-hmm. And I guess that's well the way that we looked at it, and I think increasingly also other investors are looking at it from that perspective as well. And the Access to Medicine Index has helped us tremendously, not only in setting our own agenda in our conversations, but I think also in putting the subject in the spotlights for the pharmaceutical companies as well.
So as a pension fund managing wealth for some of the world's wealthiest citizens in the world, how do you feel your clients are truly engaged in this particular issue, in health equity and health access? Are they asking for more answers and investment tools that are in place?
Well, interestingly enough, we actually asked the beneficiaries of our pension fund clients every year, almost at this time or at this rate, what they consider to be important subjects to engage on. So there's a survey that we send around annually, and what we hear back from the participants of our clients is actually that health-related subjects, as you probably can imagine, given the fact that we all work for the healthcare pension fund, are actually very important to them. So, and we use the outcome of these surveys as an input for our investment policy altogether. So it really helps us steer the focus with regard to the engagements that we do. And as you probably can imagine, given as health is a very important subject, we talk about these things quite extensively with the pharma companies that we invest in, and also just broader healthcare companies.
Now, is there a difference in when you're working with pension funds versus other institutional investors and banks in terms of their engagement on access to medicine and health equity issues?
The opportunity that we have as a pension fund investor is that we can actually really look at it from a long-term perspective. So for us, it's not so much about realizing short-term gains. So we have that relative luxury to really build a relationship with these companies, also in our engagements, which enables us to have these longer-term conversations and really guide these companies through that whole journey that we both are going through in improving access.
How do you approach engaging with healthcare companies and industry on access to medicine? How do you actually do this?
Well, first of all, we get all the input that is out there. So we use the research by the Access to Medicine Foundation. We use other types of research that we can that we have access to, and ensure that we get like the full picture of where a company is at that moment, and also where we want them to head into with regard to their performance on access to healthcare, but also other environmental, social, and governance topics. And then pretty much the journey starts. So we think about the type of objectives that we want to achieve, the timelines that we set for those objectives, and from then on, it's really just get into the discussion. And yeah, interestingly enough, historically, this has always been quite a journey, in all fairness, because quite a few companies really didn't have any idea when it comes to topics like access to healthcare, access to medicine, and what they could do about that. So, like well over 10 years ago, having these types of conversations with companies that would fall outside of scope of the Access to Medicine Index was just a challenge in itself, because it was just an abstract concept. I think that's still the case in some instances, but mostly, and I think that the Access to Medicine Foundation has been instrumental in achieving that. Mostly the topic is very well known. There are specialized access teams that actually have that work quite diligently, both internally but also externally, with investors and NGOs to discuss the subject and to bring that further. And I think that's been extremely helpful.
And then have there been differences between the countries? Because you have engaged with companies headquartered in Japan, in the US, in Europe. Have there been severe differences in terms of how they engage on access to medicine issues with investors such as yourself?
Definitely. Yeah, I think if you look at European companies, and I think that's also to some extent evidenced by the outcome of the Access to Medicine Index every 2 years. I think European companies traditionally were quite advanced on this particular subject. Mm-hmm. If you compare that to the US, it's something which needed to be promoted a bit more. So I think at least the idea back in the day mostly was that investors didn't necessarily care about this subject too much. So those are definitely interesting conversations to have back in the day. And if you then look at Japan, for example, there, interestingly enough, it was usually more of almost a modesty that companies used to have, which also translated into their efforts being mostly philanthropical, mm-hmm. Which has its part to play, don't get me wrong. But then at the same time, from an investor perspective, we also want these type of initiatives to be sustainable in the long run. And that's where more of a business approach comes into play. But yeah, in general, I think across all those regions, I think globally, the industry has definitely made a lot of improvements over the past few years.
We've seen that there's been a number of companies where the emerging market revenues have actually been consistently high. Almost to a third of their revenues is being generated in emerging markets. And this is not necessarily what we've seen 20 years ago, right? So there's a huge growth in terms of industry's efforts globally. Is that reflective of their own efforts? Do you think that there is a lot more movement in the investor community that has driven that? Can there be more?
Of course, we were always trying to convey the message that access had a commercial value, mm-hmm. As well, also in LMICs, so low middle income countries. And that was quite a challenge to convey that message back in the day, because the traditional approach, of course, from a lot of the pharma sector was that like the markets that were most profitable were also the most interesting, and anything that would go beyond that was of less importance. I don't think, of course, that has changed tremendously for many companies at this stage. But I think the realization that, especially in a more challenging developed markets situation that a lot of these companies are currently facing and are increasingly facing, I think the realization that in order to remain profitable in the long run, there is actually a huge opportunity for them to take or to strive towards in these particular upcoming markets.
Can you give an example of how access to medicine becomes important for both investors and pharmaceutical companies from a financial perspective?
Well, one example that comes to mind, is the fact that the industry itself is actually facing more challenging environments, and that increasingly so with regard to the more developed markets approach. So the traditional approach that pharmaceutical companies used to have has become more strained over the past few years, which just means that there's a great need for them, not only from a social perspective, but also from a financial perspective, to look at other markets in order to generate revenue. So traditionally, the pharmaceutical model of getting relatively higher revenues from a smaller set of markets is something which has become more strained over the past few years. So what we see is that companies need to expand their geographical focus in order to ensure that the revenue growth that they strive towards, and that, in all honesty, also investors expect from them, is actually being maintained. And to that avail, looking at markets that go beyond that traditional approach is definitely something that we increasingly see and also expect from the companies that we invest in.
Does that change the way that they do R&D or change the way that they set prices? I remember about 10 years ago, you were in a panel in the Financial Times where one of the CEOs, who no longer is a CEO of a pharma company, actually said, well, my drugs were not invented. My drugs were not invented for use in these markets. So I'm not responsible for health equity in these particular countries itself. So has that changed?
That has definitely changed. So I think the previous thought about what the role of pharmaceutical companies was has definitely evolved since then, and it's like I think the traditional view that there's like this corporate citizenship perspective has also evolved further. So now, as opposed to looking at the subject of access from a responsibility perspective, it's really more like a business view that companies now take. And I think across the board, regardless of geography or subsector or what have you, I think there's an increased understanding that there's essentially, apart from having a positive impact, there's also money to be made in these particular markets.
How has engagement from institutional investors actually changed the pharmaceutical industry? Has there been internal change? Has there been change in terms of how they approach access to medicine globally?
It's definitely changed, I think, to some extent, because of the efforts that institutional investors such as ourselves have put into this and into the conversations that we've been having, the engagement that we're doing. But I think it's definitely something which is a joint effort, not necessarily joint and as in we do these conversations together, but I think there's a lot of push from NGOs, just civil society, with regard to the expectations of the sector. And investors such as ourselves, who have been fortunate enough to build these relationships with those companies, have been able to put the subject on the forefront, have hopefully contributed to these companies doing better on the subject of access to healthcare. And I think what has really helped as well is the fact that we have, within those pharmaceutical companies, there are people who really are in agreement with the views that we have.
They value your engagement.
Exactly. And we really see that there's a lot of counterparts on the side of the companies who are really drivers for change within those firms as well. And being able to have those conversations with them hopefully strengthens their position and their efforts within those firms in order to bring about change and improvements within the companies.
So if an investor does not ask questions about access to medicine and how health equity is driven, then there'll be less effort.
I believe so, yes. And I think increasingly the entire investment community has put this subject on the agenda. So that has definitely helped. I think it's also helped that, of course, the Access to Medicine Index has put a lot of focus on these type of topics, brought about some competition as well among companies. So I think that has probably been quite instrumental in making this part of the company's strategy more than it has been in the past.
And when you look at a company strategy itself, what specific metrics or results do you look for in those results?
Yeah,
what matters the most for you?
Yeah. So for us, it's mostly, or it has actually changed over the years. So whereas in the past, we would actually be focusing on having discussions on differential pricing, topics like that. I think that to a large extent has improved already with quite a few companies. So not to say that's all done and dusted, but that has definitely improved over the years. However, there's still a lot of topics, and I think that was addressed as well in the latest installment of the Access to Medicine Index. There are still some topics like voluntary licensing that are not at the level where we expect it to be. So those are the type of discussions we still need to have. But if you look at the efforts that are being undertaken by a lot of these firms, we're definitely heading into the right direction.
How do you balance your fund's financial goals with your clients' desire to create real impact in healthcare?
Traditionally, I think a lot of investors, including PGGM, were mostly driven by financial results. So essentially, what we wanted to achieve is a good pension for the beneficiaries of our clients, and that was the primary driver. We moved beyond that, I think, well over a decade ago, when we started to focus more on responsible investment, where it was not only the financial side that was important, but also the corporate social responsibility side of things. But that was mostly from a risk perspective. So try to mitigate those risks by excluding particular companies, by talking about things that actually went wrong. And I think if you look at access to healthcare as a topic, that was actually one of the first subjects where we were driving for a positive impact. So we were pushing for change, which actually wasn't necessarily something that was considered to be a risk or anything. It was really trying to make a change and a difference in the lives of people from a more positive perspective. And yeah, that's definitely something that we built further on over the past few years. And we're now actually at the stage where we're trying to not only look at risk and return, but on the same level, look at sustainability. So all those three factors are looked at with equal importance. And that's definitely something that has changed within our firm, and I think increasingly also with other investors.
So PGGM has actually divested away from sectors that do more harm than good, like in tobacco and oil and gas. And here we're talking about a sector where the pharmaceutical industry has a huge potential to do more good than harm, but it's seen as a sector that doesn't do enough. It actually does create a lot of harm. What kind of tools do you use to make sure that that changes towards a positive impact and to do more good than harm in the pharmaceutical sector?
Yeah, to us, divestment is really the last resort. So ideally, we would be able to invest in across all sectors. Having said that, it's definitely, like you mentioned, there's a few sectors which are just difficult from a positive impact perspective to remain invested in. So tobacco, back in the day, back in 2013, we were the first large Dutch institutional investor who divested from tobacco. If you look at oil and gas, we've had a very intensive engagement with the companies that we invested in within the oil and gas sector over the past few years. And as a consequence, unfortunately, because there was not enough improvement from those companies, we had to divest from a very large portion of that particular sector. If you look at pharma, like you mentioned, they are uniquely positioned to actually have a positive impact. And indeed, the reputation of pharma, on the other hand, is not very much aligned with that potential. And I think, if I remember correctly, back in the day, there was a Gallup poll, which I refer to every now and then, where it turned out that the tobacco sector actually had more trust from the general public in the US than the pharma sector used to have, at least. So there's a lot of pushback, I think, reputationally towards that sector. And then again, by being able to have that positive impact, they can actually show that the distrust that the general public may have is actually not justified. So it's, as far as they need to be incentivized even more than they already are to ensure that they take on that role in improving health globally. That's something that they'll benefit as well from a reputational perspective.
And reputation matters in these companies.
Oh, definitely.
Yeah.
And not only to those companies, but also to ourselves. If you look at the messages that we get from our beneficiaries, from the beneficiaries of our clients, media, NGOs, etc., they're very much on top of these type of issues, and rightfully so, and are not only eyeing the companies themselves, but also are going after investors that they believe should, actually steer for change within those companies.
And what kind of tools do you use to steer that change?
Well, for us, engagement, of course. So the active dialogue that we have is the main tool that we have at our disposal. Where possible, or actually in some cases also where needed, will add our voting to that. So we have the opportunity to vote at shareholder meetings for the listed companies that we invest in, and if need be, we'll vote against the company board or a certain shareholder proposal. We'll support certain shareholder proposals which are aimed at matters which could indeed be about improving access. So these are typically the tools that we have. And of course, there's divestment as well, like we've done with some other sectors and some other companies. But again, that's really the last resort.
And when you think about responsible investments, is it today, in terms of the larger investment community, only a small minority of investors that are really driving responsible investments? Or do you think that this is a growing change that's going to really be leapfrogging in the next few years?
If you would have asked me that question, I think a year or a year and a half ago, I would say it's increasing,
Yeah.
and it will be bigger, will become bigger over the years. Um, the reason why I phrase my answer that way is because you see some pushback in some regions around the world on responsible investment.
Well, that was going to change the way you vote. It changed the strength of your vote in shareholder meetings. Correct? In the future, if you're not surrounded by like-minded investors who are going to vote alongside in a similar way,
that's definitely going to make it difficult. So we will still work together with other investors as well in collective and collaborative engagements, in also with pharmaceutical companies, in order to achieve those goals that we set for ourselves. But we do see that there's a lot of pushback in some parts that to be as outspoken as we could be, or as we used to be as they used to be, I should say, on these type of topics, is becoming increasingly challenging.
So it's really more important, very, very important to keep collaborative engagements across a number of different investors going. I mean, we host over 140 investment firms that have signed up to the principles of access to medicine and use our research, who engage with the industry, who use voting rights, who use the results of our research in stock valuation models. Is it important to continue this despite the pushback that we're starting to see?
I think it's going to be increasingly important that investors collaborate and ensure that the message that we've been conveying over the past decade, well over a decade, is still there. But the challenge will also be on the company side. So to what extent will companies, especially in some parts of the world, still feel the liberty to and also have the resources available to push for better access?
Yeah, and better change.
Exactly.
Yeah. Looking ahead, what are your priorities for the next 3 to 5 years in engaging the pharmaceutical industry in low and middle income countries? I mean, what do you envision the evolution of the role of investors in the space?
So over the next few years, what's going to be most important is to show and provide evidence of the impact that companies are having. So to ensure that that's being measured in a consistent manner across the entire industry. So there's several initiatives taking place on that on that particular front, and that's going to be increasingly important to move away from trust me and move towards show me.
As someone who's been working with the pharmaceutical sector on health equity issues and access to medicine for so many years, what is your message to other institutional investors on how they need to step up their game in driving access and engaging the industry in this?
Institutional investors such as ourselves, of course, are I think well positioned to look at this from a long-term perspective, and to ensure that the interests not only of the beneficiaries from a financial perspective are being taken into account, but also from an impact perspective. It's really important for investors to stay the course. So there's been a lot of collaborations going on over the past few years, which I think have been quite productive and have helped providing the support also to the companies themselves to do more when it comes to access to healthcare, access to medicine.
Mm-hmm.
And we have to, maybe with a smaller group, because it's going to be more difficult for some to actually stay, to stick to what they were doing before. But the ones that remain really have to push harder for this going forward.
What can we do more in the Access to Medicine Foundation to mobilize more investors to prioritize health equity issues in the financial sector?
Well, what has helped tremendously over the past few years is the expansion of the research that you've been doing. So apart, of course, from your work on the Access to Medicine Index, but also on antimicrobial resistance, on the generic sector. Because what we typically see is that the best way to show the added value of the index is have a conversation with what I used to refer to as company number 21. So that one company that wasn't covered, that had ideas on where they should be going and probably drew inspiration from the index as well, but were not being measured and therefore not also getting the questions from the investment community, which could draw upon the research that you as the foundation have provided.
So how do we build stronger accountability for companies that that are inspired by and draw motivation from our research, but are not measured?
Well, what has really helped is the collaborative sessions I think that you've had over the years. So they are not necessarily only being attended by companies that are part of the index coverage itself, and maybe through collaborative organizations or trade associations like the IFPMA, just industry bodies which could really help and get some insights in what is actually important about this particular subject.
Can you unpack the difference in how you engage and sort of the response you get from a company that has never been measured by the Access to Medicine Foundation's efforts, compared to a company that has been measured consistently over time on the Access to Medicine efforts itself?
I think the biggest contrast is probably the type of expectations that these companies face from the side of investors. So if you look typically at companies that are being covered and are measured by the ATM index every 2 years, they are very or quite knowledgeable when it comes to these type of issues, whilst companies that fall out of scope or that are in different sectors that are still within the healthcare sphere, they are usually quite unknown or they unaware of the subject, and it's relatively new to them. And in some cases, we're probably the first or one of the first investors to even bring up the subject.
So the kind of responses you get will be very new and perhaps not necessarily aligned across the whole business.
Exactly.
When you ask questions about it.
Yeah.
PGGM has a unique position in having a long-term view on healthcare investments. How do you embed similar incentives in the pharmaceutical industry?
So for us, it's really important that the idea about or the strategy behind improving access to healthcare, access to medicine, is something which is really ingrained within the organization. And one of the ways of doing that is that over the past year, we've been pushing more and more to integrate access principles into the executive compensation, so the remuneration of the CEO and other board members. And that's really to ensure that the company's strategy on access is not dependent on the intrinsic motivation of one individual who might be the CEO of that company at that time, but really there's an actual financial incentive as well to look at this with a long-term view from the executive side.
So in the Access to Medicine Foundation, we have seen that more and more companies are embedding access to medicine strategies as part of their corporate strategies itself. Can you tell me a little bit more on why executive compensation and remuneration will make a difference? When does it work and when does it not work?
Yeah. Well, for us, it's really important, of course, that first of all, the executive compensation, when it comes to including access to medicine metrics in there, that they're meaningful. So to ensure that they're actually driving, that the drivers that are part of the executive compensation are going to be important to improving the access challenges that are there. And to ensure that these companies also have executives that have actual skin in the game and are being valued or for the efforts that they undertake when it comes to improving access. And that's something that is going to be a challenge, and some investors may disagree on what type of metrics to use. And may feel that or may differ from with regard to views that we may have. But it's if you look at it from a business perspective, similar to other metrics that you have in place with regard to total shareholder return, more financial related metrics, it just puts it at that same level, which is important to us. So it shows the importance that access has in relation to the overall strategy that a company has.
So, give me an example. I mean, a lot of companies have been looking at access as philanthropy or via their foundations itself. If you don't have financial metrics related to access to medicine at the CEO level, is there going to be a difference in the way they continue to operate?
It all remains to be seen, obviously, but we just don't want to have it tied too much to the goodwill of one individual or the existence of a foundation. And what we typically see is that having a foundation in place works really well for some of the companies, from some of the pharma companies that have that. But we do think that if you really want to look at it from a more sustainable perspective and to ensure that access is being looked at as an activity that is also self-supporting, which we believe is extremely important to make it durable in the long run, then it has to be across the whole business. So including the teams that are working on this, but also the entire board. So everyone who's involved in improving access should also be rewarded for that.
We've identified a trend where more and more companies are embedding access in a sustainable way by also engaging in inclusive business models, and in that way ensuring that more of their products and portfolios are actually included as part of their commercial activities in low and middle income countries. What are some of the metrics that, as an investor, you're looking to see that demonstrates the impact of some of these efforts?
Well, for us, it actually comes down, like one of the most relevant metrics that we consider out there is the number of patients reached. And it seems like a very simple metric to have. However, that's already proven to be quite a challenge to quite a few companies out there. So what we're now trying to push for this at least to be the one metric that the entire industry is using, with all its pros and cons out there, and then ideally just ask companies to build upon that. So if you want to specify or provide more insights on top of that numbers of patient reach metric, it's absolutely fine. However, that should be like the bare minimum across the entire industry. And we see some initiatives out there that are pushing for that. And ideally, we'll come to a situation where it's not only investors that are asking for this, but it's the entire group of stakeholders. So whether that's NGOs, whether that's the pharma sector itself, that everybody steers towards having at least the number of patients reached as a metric, which is being reported on an annual basis by the companies.
We have noticed that the pharmaceutical industry has definitely done more to improve access to medicine, and there's been consistent changes over the last years in demonstrating, a stronger and stronger impact. Often it is applied in only selected therapeutic areas or selected markets where the opportunity and the networks are actually there. And that means that scale and scope of bridging that health equity gap and really reaching the billions of people who still need access to medicine is still a far goal. In order for us to maintain the progress that we've made so far and really ramp up and scale up that efforts, what do you believe investors need to do and prioritize in the next few years?
Well, I think, first of all, investors need to stay the course with regard to their messaging. So what we've been doing over the past few years is really ensure that the companies at least as far as we could, felt the support that there are investors out there who care deeply about this particular subject. If you look at the industry itself, what has always surprised me is the lack of collaboration among pharma companies between themselves to see what they can do collectively to strengthen healthcare systems.
Mm-hmm.
And I understand that from a competition perspective, it might be difficult to collaborate too much. However, I think that's going to be key in order to ensure that the access issue is being tackled even better than it is nowadays. So to not only collaborate, to not only seek for collaboration between pharma companies and healthcare systems and governments and NGOs, but actually between pharma companies among themselves. Because our messaging towards pharma companies when it comes to their performance on access to medicine has always been that we don't expect them to compete against each other. So for us, it's really important that they do well, that there's a positive trend in their performance, but we will not say company A that they're doing worse because they have reached less patients than company B, because it's always going to be, well, depending on a particular situation, a geography, their products, etc. So the collaboration to us is really key. And hopefully that's something that not only we, but also other investors keep pushing for the foreseeable future.
In today's episode, we've heard a lot about how institutional investors can drive change in the pharmaceutical industry to ensure that we're bridging health equity gaps worldwide. We've talked about solutions that really work, metrics that institutional investors are looking for and are engaging on with the pharmaceutical industry, and we've talked about a vision of how we can really bridge these gaps globally, worldwide, so that no one is left behind. Thank you again for joining us on this episode of the Health Equity Podcast.